Okay, so let's talk about health news. We're absolutely swimming in it, right? But what does it all actually mean? Well, over the next few minutes, we're going to build a really simple framework, a tool, to help you sort through all of it. You'll be able to figure out what you're reading, why it was written, and maybe the most important part, who was it really written for?
You know that feeling, right? You're just scrolling and it feels like you're getting whiplash. One headline says one thing, the next says the complete opposite. It's just impossible to know what to believe sometimes. So just to show you what I mean, let's look at 3 totally different headlines you could bump into any day of the week.
Okay, first up, something like this from the American Heart Association. See how clear that is? It's promising simple tips you can actually use. It feels super approachable, and well, that's the whole point. It's designed to be.
All right, then you might stumble upon this one. A little more clinical, right? Chemo prevention. That's a mouthful. It just means using something to try and stop cancer before it even starts. So it's a technical term, but you can kind of get the gist. You can tell this is coming from a different, more specialized place.
And then you see this. And you're just like, whoa, what? What on earth is a default mode network? For the record, it's the part of your brain that's buzzing when you're daydreaming, but still. And connectivity, this is dense. It's technical. And for most of us, it's just completely baffling. And you know what? That's the key. That's the whole point. Not all health news is the same because it's not all written for the same audience. So, to sort all this out, we're going to use something I call the information pyramid. We'll start at the bottom with your daily headlines, then we'll climb up to the actual research, check out what your doctor reads, see what's happening at the very top, and then wrap it all up with a toolkit you can start using today.
All right, let's dive in. We're starting at the bottom, the base of the pyramid. This is the stuff most of us see every single day, and it's the biggest part because it's meant for pretty much everyone.
The number one thing to get about this level is its purpose. Seriously. Places like the American Heart Association, they aren't just spitting out data. They are on a mission to be translators. They take all that complicated science and boil it down into something you can actually do, and they often wrap it up in a story you can connect with. And here's the really important part. This stuff is almost always checked by doctors before it ever gets to you. The goal is safe, useful advice.
And this is a perfect example. See, it's not a chart or a graph. It's a story about a real person, Deborah. And suddenly, you can picture her, right? Her story makes the information about heart attacks feel so much more personal and urgent. That's the superpower of this kind of health news. It's trying to connect with you on an emotional level.
Okay, time to climb up one level. So you have to wonder, where do all those public health stories come from? Well, a lot of the time, they start right here with the original research. And let me tell you, it is a completely different world.
Okay, this right here, this is the big aha moment. The difference is just everything. On one hand, you have public news. That's one message going out to millions of people, trying to give simple advice. On the other hand, you have a research abstract. That's a message from a handful of scientists to another handful of scientists. Its goal has nothing to do with advising you. It's literally just about reporting data in a super specific technical language.
So when you find yourself looking at one of these, what you found is a scientific abstract. The best way to think about it is like it's the spark notes for a huge research paper. But, and this is a big but, it's written in a secret code that only other experts in that exact same field are expected to understand.
Hey, remember this headline? The one that made our brains hurt a little? Well, now we see it where it actually lives. This is the title of a real study on PubMed, which is this giant library of scientific papers. This was never ever meant to be a catchy headline you'd see on the evening news.
And that brings us to the most important takeaway here. When you see all that technical jargon, you're not looking at the finished meal. You're looking at the raw ingredients. An abstract is just a report card. It says, here's how we did our study, and here's what the data said. That's it. It's just one tiny piece of a ginormous scientific puzzle. It is definitely not direct advice for you.
All right, let's keep climbing. So, we've got the news for the public at the bottom and the raw science data one level up. So what's in between? Well, there's this whole other layer. It's basically the conversation that doctors are having with each other.
This is the world of professional journals, like JAMA, the Journal of the American Medical Association. When you're reading an article from a journal like this, you're basically a fly on the wall, listening to doctors debate what's new, what's working, and what the latest evidence is showing.
I mean, just look at some of these topics from one single issue. We're talking about super specific stuff, mobile dermatoscopies, next-gen sequencing, comparing different kinds of minoxidil. This is information for the doctor in the clinic, the one on the front lines trying to make the best decisions for their patients.
It's definitely more practical than the raw research, but way more technical than what you'd see on a public health website.
And now we've made it to the very top, the peak of the pyramid. So what's even bigger picture than doctors talking to doctors? How about documents that are meant to guide entire countries or even the whole planet?
Yep, up here is where global policy lives. This is the playground for big organizations like the World Health Organization, the WHO. And let's be super clear, they are not writing for you. They're not even writing for your doctor. They're writing for governments, for health ministers, for the people running entire national programs. Just look at the kind of stuff they publish. Toolkits to wipe out a disease across a whole country. Guides for crunching data from thousands of health centers at once. Strategies for entire nations. This is the ultimate 30,000-foot view. It's about building the whole system that makes healthcare possible for millions of people.
Okay, so we did it. We climbed the whole pyramid, from the everyday news all the way to global policy. That's great, but so what? How do we actually use this the next time a health headline pops up on our phone? Well, this pyramid thing, it isn't just a neat idea. It's a tool. It's like having a mental map. The second you see a new health story, you can instantly figure out where it belongs on the map, and once you do that, you know exactly what to expect from it. And here's how you put that tool to work. It's just 3 quick questions. Number 1, who is this actually for? Is it for me? Or for a scientist, a doctor, a government? Number 2, what's its purpose? Is it trying to give me advice, just report some data, or set some massive policy? And finally, number 3, is this the final word? Or is it just one more piece in a huge ongoing puzzle?
So I'll leave you with this thought to chew on. Think about the last health story you read. What was it? Was it one of those inspiring stories from the bottom of the pyramid? Was it a super dense scientific abstract, a debate between doctors, or a high-level policy plan? As soon as you can place it on the pyramid, you'll know exactly what to do with it.